Welcome back to Smitty's Learning Room. Today we continue to look at the sports medicine HSC option, and we're going to look at the dot point related to taping and bandaging. And so when we have a look at this concept, we know that it comes from the focus question, what role do preventative actions play in enhancing the well-being of the athlete? And so in this video, we're going to have a look at taping and bandaging, and we'll look at preventative taping, taping for isolation of injury, and bandaging for immediate treatment of injury. And so after having a look at this video, you should be able to look at questions around evaluating the role taping plays in both the prevention and treatment of injury. So let's start by having a look at what do we actually use taping and bandaging for in relation to sports medicine. Now, taping and bandaging is often used in sport, but mainly for the rehabilitation and the prevention of injuries. And you'll see taping and bandaging used from amateur athletes, beginner athletes, all the way through to professional athletes. So we'll start by having a look at preventative taping and what role does preventative taping take in relation to sports medicine. So we start by having a look at, well, why do we use preventative taping? We use preventative taping to decrease the chance of injury, and this is particularly injury at prone sites. So, for example, joints of the knee, the elbow, or the shoulder, or even fingers and the ankle. Preventative taping can also increase support for physically demanding sports. So, sports like netball or rugby union or diving, sports that require high speeds and change of directions. You'll often see athletes taping for preventative measures. And this is usually because they need an increase of support for areas which have previously been injured or areas that are very prone to injury. Now, some clubs and associations or coaches may put procedures or policies in place where athletes have to, tape joints or parts of the body which are more prone to injury. So, for example, a netball coach might request that their players tape both ankles to provide further stability, to avoid for rolling ankles because of the nature of the sport is very high paced and a lot of change in direction, which can cause for weaker ligaments, which might mean that the ankle joint might need some further stability. So when we look at preventative taping, there's a couple of considerations that we need to think about. And the first thing is the size of the tape, so looking at the width of the tape. So obviously if we're taping a finger, we don't want anything probably wider than perhaps 1 to 1.5 centimetres. If we're looking at taping an ankle or a knee, obviously we're going to need something much thicker than 1.5 centimetres, and we're probably looking at something like sort of 8 to 10 centimetres in width for a knee or an ankle joint. Now, when taping body parts, it's important to place them in a position that they'll mostly be in. So, for example, with an elbow, you're not going to tape the elbow in its straight form. You'll have a slight bend in it because that's the natural sort of position that the elbow will be in, and will also allow the athlete to still move their arm in an extension and a flexion motion, but still provide the stability of the tape. It's also really important to allow for the muscles to contract while taped. So, for example, you'll find often that sometimes tape may not go all the way around the body or around the limb to allow for that contraction to occur. Or tape may be placed on an angle. So, for example, if an anchor is maybe placed on an angle on the ankle or the just above the knee to allow for the muscles in the calf or the muscles in the quads or hamstrings to still be able to move. It's also important to make sure that tape is overlapped when it's being used. This obviously allows for the taping to be strengthened, but also to ensure that there aren't any gaps in the taping or wrinkles in the taping, which can cause further damage in the form of soft tissue injuries such as blistering or grazing. So once you've actually taped an athlete's body, there's a few things that you need to take into consideration after taping. Ensure that the circulation is still okay within that joint, And obviously you can do that by testing the extremities, but also just having a look at the colour. If the joint that has been taped is quite red, that's obviously going to suggest that perhaps the circulation is being cutting off, and you need to retape that area and not tape it as tight as previously done. You want to make sure that the taping restricts the body movement. Obviously you want to allow for some movement in the body, but when you're looking at taping for preventative, obviously you want to make sure that you're preventing further injury from occurring, so you need to make sure that that tape is restricting body movement, which can enhance injury. Whilst doing this, it's still really important to ensure that the body part still feels comfortable. So again, you want it to be in a comfortable position and they can still move the body part, but feels as though there's restriction from, say, pronating a foot or an ankle to prevent the injury. So another way that we can use taping is for the isolation of injury. And so we've had a look at preventative before, and now we're looking at, well, how can we tape, or why do we tape to isolate an injury that's happened? And the reason we do this is for various reasons, but for some of them is to increase the strength of the joint during rehabilitation. So for example, a knee joint after a knee surgery may be taped so that the athlete can still walk and undertake light exercise, so that they can build the muscles around the knee joint. This will also decrease the chance of reoccurring injuries. So obviously, if an athlete is coming back from an injury or from surgery, when they're rehabilitating, sometimes their body or the ligaments aren't quite ready to be used yet, or aren't strong enough to support that joint, and that's where the taping comes into play and therefore decreases the chance of reoccurring injuries. And obviously with that support and stability in the joint region, it's going to increase the confidence for return to play for that athlete. Now, it's really important that if an athlete is returning to play or has an injury, that they strengthen their muscles around the joint, as well as providing support from taping. One of the biggest issues that athletes have with rehabilitation is that they rely on taping so much that they don't actually build strength in their joints or their muscles surrounding the joints, and therefore these injuries continue to happen. Finally, we have a look at bandaging for treatment. And so we know that when we use bandaging, we've seen that in the RISA application, when we look at the C for compression. So if there's been a soft tissue injury that's happened, immediately you can apply a bandage to help decrease the swelling after that soft tissue injury through compression. Now, obviously, because we're applying that bandage and applying compression, we're going to have a decrease in inflammation to the joint due to a decrease in swelling. And we know that from having a look at the inflammatory response, that decrease in swelling obviously allows our body to then start the healing process and remove any unwanted waste in the area and help rebuild tissue. Obviously, when we look at hard tissue injuries, bandaging allows for the mobilisation of these injuries. So, for example, using a bandage to splint two legs together if there's a broken leg, or using a bandage to create a sling for a broken collarbone or shoulder. So it's really important to remember that when we look at taping and bandaging, we have taping for the prevention of injury, we have taping for the isolation of injury, and we have bandaging for the treatment of injuries.